Welcome to Voices in Care, a Blessing Health System podcast. I'm Beau Becraft, and today we are talking with members of the Sterile Processing Department to talk a little bit about Sterile Processing Week. Am I right? Yes. Is that what's going on right now? So introduce yourselves if you wouldn't mind. Tell us what you do and how long you've been with Blessing Health System.
I am Faith Coburn. I have been with Blessing in the Sterile Processing Department for about 8 years. 6 of those years I have been a charge tech, so I get to boss John around.
And John?
I'm John Buren Jr. I've been with Sterile Processing since about January of 21.
So we've obviously come a long way since sterilization practices from, washing equipment and tools in river water to a more science and technological-based system. So tell us a little bit about what sterilization is, what that process entails, and what your roles in that process are.
So we take care of all of the surgical instruments. So we assemble them, we disassemble them, we clean them in special detergents, we send them through our disinfector, but disinfection is not the same as sterilization because disinfection doesn't kill everything and sterilization does.
So tell me a bit about the differences between those then. Where are instances in which you would use disinfection compared to sterilization?
So at Blessing Hospital, in our department, we do not do disinfection. We only do sterilization because it is safest for the patient.
So what equipment is involved with this process?
Well, we got sterilizers. We have washers. So, for example, when the things come down, the instruments come down from the surgery, we actually have a type of sink with a special detergent that we have to put the instruments in, let them soak for a little bit, and then we need to thoroughly inspect them to make sure that any debris left behind from the surgery gets off before we even put them in the washer.
So from point A to point B, so when they transfer out of your care, so to speak, how do they remain sterile between each procedure?
So before we put them into the sterilizer, we have like these rigid containers with filters in them that allow the sterilant to get in, or we have, we just call them wraps, but we wrap the tray in that and we tape it so that it can be opened aseptically on the field. But that is the sterilization barrier, essentially, to keep everything out that we want to keep out.
It seems kind of like a low-hanging fruit question or kind of the obvious, but what is the importance to the patient as well as the care provider of having sterile tools?
I mean, it's so important.
It is very important.
So important.
Because at the end of the day, there's these instruments that we are working on touch the inside of a patient. So we need to ensure that they are the utmost clean. That way the patient doesn't end up getting an infection many months later, unknown, and it ends up turning into a worse ordeal.
Yeah, and I would even just add, because Blessing is a community hospital, we take care of our community. These are our friends, these are our neighbors, these are our family members. We want them to have the best.
Are there any common misconceptions? I know this is kind of a niche department or division of a care facility. Are there any misconceptions that people might have about sterile processing or things that you would want them to know about what you do and why you do it?
I would say one thing is that they don't realize how technical of a job it is. We have to hold international certification to keep our job. I actually have 2. So we have to have our CRCST certification through the Healthcare Sterile Processing Association within 12 months of hire. But I mean, you have to know all about microbiology. You have to know, what cleaner you can use with this instrument, or, this instrument can't be sterilized at a high heat, so it's got to be in a lower temp. And so every instrument we have comes with a little instruction packet. We call it an IFU, Instructions for Use. And I mean, some of these things are hundreds of pages long, and we got to read every single one of them.
So this sounds like a really low pressure career, really low stakes, no major issues at all. So tell me a little bit about, you mentioned the certification process. You have to have international certification to perform your jobs. How do you obtain that certification? What does that process entail? And how does it help you be a better sterilization tech?
The certification process is kind of split. So half of it is academic, where you take your quizzes and do your studying. But then you have the other half, which is on the job. So you're actually working with things. You're actually seeing how things come down, and you're actually like working with the process. And you're required to have at least 400 hours of on-the-job experience.
Now, is this a certification that you have to obtain certain intervals, timeframes? Do you have to recertify every so often?
We recertify every year
Okay.
with 12 continuing education units.
Got it. So what led you each to this path of all the careers that you could have chosen? How did you end up here? And was it a direct path? Did you come directly into this specific business area, or did you kind of climb a ladder, so to speak, go through different divisions, departments, that type of thing? What's your journey been like?
I think John and I kind of fell into it the same way, actually. We both had a friend who worked in the sterile processing department, said, hey, I think you would really like this job. It's interesting. There's a lot to do, and so, I came in and I instantly fell in love because I'm very, very particular. And I like rules. Yeah. So I'm very good at following rules, which is all about.
That's a good characteristic to have in healthcare. And John, what about you? What's your journey here been like?
My journey has been, how do I say it, very interesting, to say the least. Of course, my best friend got me into this job, and really, it was out of nowhere. You know what I mean? And it turns out, as I started this job and I began to really get into it, I realized the importance of what I'm doing. I fell in love with it. And now I just have developed a passion for it.
So what do you hope to take away from this career long term? When you look back at your career in 25, 35, 45, however long it is, what do you hope to have taken away from this career?
I would like to say that what I hope to take away from this career is the fact that I did good for the community. And really, it's like I'm not out there in the front lines. I'm kind of behind the scenes, and I like it like that.
So you kind of like the unsung hero element of it, so to speak.
Yep, I did my part, and I did my very best, and that's all I can take away from it. And I'm happy with that.
So tell me, is there something that drives your mission in this department? What is the overall focus of this department?
Well, our department motto is there's a patient at the end of every instrument. We really make a conscious effort to remember that even though we don't have direct patient contact, our work directly affects patients.
How do you see this field changing, or how has it changed since you began in this area?
I think coming up, I feel like it's going to require more education. Because, we have people who have been in our department for 30 or 40 years, and, they just walked in and started doing it. But, our technology has come so far in the past 30 to 40 years. Like, medical technology has just exploded. Like, we're doing robots now, which we never would have done.
Sure.
But all that comes with really complicated, IFUs.
Yeah.
So I think, formal education is going to be in the future.
John, how have things changed since you began?
Things have changed quite a lot. And for example, the robots and the way we process them. When I first started, I think we were just starting our journey of processing robots and everything. And the fact that it has changed so much in the last 3 or 4 years. There used to be a real big process, and then for a while it got shortened, and then it got longer again. It's never ending.
It's kind of constantly evolving.
Evolving to be the
Do you have
best.
a Tony Stark situation? Do you have names for the robots?
I don't think we have names for the robots.
No, not that I can think
I'm
of.
sure you probably said some few choice names when they're malfunctioning, if that's a possibility, I'm sure. This is an oddball question. Do you have any favorite tools that you like to sterilize? Do you have a tool that comes in that you're like, yes, this is my bread and butter?
Oh, yeah, the heart tray.
The heart tray? Can you tell us a little bit more about what that one entails?
The heart tray is you have to be so meticulous with the way that you do it and process it and how you put the instruments in the trays, because it has to be set up to design. It has to be designed to be able to be grabbed out in the best way possible without it falling, without the instruments dropping. We have to demagnetize everything that we touch as well when it comes to the heart, due to the fact that
like pacemakers or implanted
pacemakers,
devices,
for example.
Yeah.
Yes. So I like to say that I am personally trying to specialize in doing the heart when it comes to processing it, just because it stimulates my brain that much.
So it has to be basically organized from an operational standpoint. So you're putting yourself in the shoes of those surgeons that are actually performing this work and thinking
Yes.
about what tool what tool am I going to grab next? What order am I going to need it in? So that is a very involved process. And what about you, Faith?
I like the abdominal tray. Just because it's really pretty once you get it all set up, and you don't have to cram anything in there, and it just lays so nice. And we have all the ringed instruments, so like our scissors and our forceps and everything, they're all lined up so perfectly, and it's just pretty. I like that one.
I bet both of you can make a really nice charcuterie board.
Oh yeah, all the
Nice and
time.
organized, very colorful, nice and laid out. Anything else that you would like to add about your work in the sterile processing department that we should know about, or things that you hope to accomplish, goals that you're proud to have achieved in this role?
Throughout my journey here, I kind of started out, it's not, I felt like it was kind of just another job before I got in there and got working. But the further I get into it, the more I'm like, this is a career. This is a professional big kid job, and I think professionalism is really, I have learned a lot of professionalism in this job that I would not have anywhere else.
As for me, basically, I want to be the best at what I do, just so I can know that the patients that are on the other end of these instruments that we don't talk to or see get the best care that they can possibly get. And that's really it.
Excellent.
Yeah,
Yeah.
At Blessing, we're really dedicated to being the best. We just achieved our advanced sterilization certification for the department through DNV, which only 21 hospitals in the nation have done. So, we're really proud of that. It was quite a process, but we have to adhere to every single, standard. So, and we want to do that. Nobody forced us to do, we chose to, put ourselves through that and, because you have to renew every year. So,
Yeah.
So that is an individual and department certification that renews every year?
the advanced sterilization is for the department, but we also do our individual certifications through HSPA every year.
Well, thank you both for the excellence that you put into your positions, and thank you for joining us on Voices in Care today. We'll see you next time.